for Doctors Without Borders in Greece. In this role, he was on the front line of ongoing refugee and the migrant crisis in Europe. He participated on assessments, emergency assignments, and evaluations in Kyrgyzstan, Morocco, Armenia, Lebanon, and so many countries. He participated and has had announcements in international and national medical congresses, and he published many relevant articles. And good morning, Mr. Veizis. Now I can leave you.
Günaydın. Davetiniz çok teşekkür ederim. Ama bugün ben İngiliz dili konuşuyorum ama gelen defa ben Türk dili olacak bu konuda. So it's a pleasure and honor to join online this wonderful symposium, and I really would like to congratulate you for the initiative, and especially I would like to thank Yağmur for her efforts and her initiative to be in contact, and it's a pleasure to share with you. So let me share with you my screen. So like this, I can do the presentation. You can see my screen.
Yes, we can see.
Good. So yes, as Yağmur mentioned, I had been working for about 21 years with Médecins Sans Frontières, Sınır Tanımayan Doktorlar. Currently, I'm the executive director for Intersource. It's another humanitarian organization. But again, working for a long time with MSF, it's something that I have to keep that in mind, and I think that's a long experience I had. So I'd like to share with you what does it mean as a medical doctor to provide humanitarian and medical assistance in crisis situation. Just for you to understand about the Intersource is present in more than 20 countries. Intervening on different emergency situations, war situations, also involving on migration, protection, and interventions in Latin America, in Africa, in Middle East, in Afghanistan, and also in Europe, including Greece and Italy, where thousands of colleagues are intervening in different situations. Now, in order for us to understand a little bit the situation regarding what it is an emergency and what is an urgency, we need to understand that an emergency is a rupture in a given equilibrium. So we as a medical doctor, we need to analyze it based on severity that is related to the high mortality of this emergency for the population. But also we need to understand a little bit what is the number of people at risk. So we need to understand the magnitude of that. So based on this analysis, we will be able to see if, for example, the severity is very high and magnitude is very high, then we talk about an urgency regarding the intervention from our side. Now, in order for a medical doctor to be part of a team and to do another active scanning of a situation, because today we have emergency situations that are taking place all around the world. So what is going to help us in order to understand better the situation? First of all, I need to share with you that there is an emergency calendar. What does it mean, an emergency calendar? Due to situations of very small coverage about vaccination, for example, in Africa, you have a vaccination about 10%. So you have time to time outbreaks of measles, yellow fever, and certain diseases. So or you have outbreak of malaria. So you know that certain period of the year, you need to be prepared for such kind of outbreaks. And of course, nobody was prepared to have an outbreak and have an pandemic of COVID. But for example, now we have an outbreak of Ebola that is taking place in Guinea. So this is something that you need to be prepared for that. Secondly, it's important that through the proper channels and the proper tools that we have today, we monitor our situation through internet and through systems that allow us to understand a little bit different emergencies taking place around the world. Another element that I would advise you as medical students to take into consideration is when you start and you learn your epidemiological topics, or you start to learn epidemiology, it's how do you read your medical data? So by being present working in a primary healthcare unit or in a hospital, looking at your medical data will allow you to do a proper surveillance in order to understand when there is a peak or when an emergency is taking place. And of course, a very important point regarding the information is networking with different actors. That means non-governmental organizations, UN organizations, authorities, and other actors in order to understand those informations and to interpret the emergency that takes place. Now, let me share with you certain scenarios for the emergency intervention that I had a chance to participate with or to be part of the teams intervening. One scenario is the communicable diseases. So already with the pandemic of COVID, we realized very well what does it mean a communicable disease. And a communicable disease brings you epidemics. And of course, today we have a pandemic. So in the case of an epidemics, I can share with you that I've been present and been working on situation of measles outbreak, malaria outbreak, also epidemics of Ebola. So that is something that affects a big group of population. Secondly, another emergency that I've been part of and I've been intervening is situation of a nutritional crisis. So when you have drought, you have nutritional crisis that brings, first of all, a situation that you have mass movement of the population. So in case that people are lacking food, you will see people moving in order to find a new location. Another emergency that I've been participating is the armed conflict. So Turkey is neighboring country with Syria that you have been seeing an armed conflict going. You have Iraq. You had situations also recently with the crisis of Nagorno-Karabakh. So in armed conflict situation, what you see as a medical doctor, you will see first of all mass casualties. So when you go in the field following an armed conflict, you will see people dying or people who have been wounded. But at the same time, people who are displacing because they are going to look for safety. That's why you see today millions of refugees in Turkey. Another situation of emergency that I've been placed and I've been part of the teams to work with are the earthquakes and floods. I had the opportunity to be present in Turkey in 1999 during the earthquake in Düzce, Adapazarı, and in Bolu, where I was part of the teams that tried to assist the population following the earthquake. So what do you see during the earthquake and floods? You see, first of all, mass casualties. So you see people dying or people being wounded. And at the same time, you see population displacement. So people are moving in order to find a safe place for them. So in all the situations, those situations are interlinked with each other. When you have population displacement, you have an exposure to epidemics. When you have population displacement, you have nutritional crisis and mass casualties. So you need to understand that in emergencies, you have always to address complex emergencies. So the complex emergencies, you need to be prepared for the interlink between each other. And the complex emergency, it's one of the difficult situations where you face issues with your safety. It's the worst situation. But also you face situations where you have flooding, where it's very difficult and you don't know what exactly to do and how to assist the population there. Another emergency that I've been a part of is the emergencies of mass movement of population, especially when you have big numbers. And just to remind you that during 2015, through Greece, there were about 1 million people who crossed the country. So it's not something that it goes on a daily basis, but when suddenly in a very short period of time, you have millions of people moving, that's quite a challenging situation. And you can face those situations in different areas and situations in the cities or in the border areas. But also during the earthquake situations, for example, that's a picture from Haiti where you need to make your operations on the street. That's also another situation where you need to prepare as a doctor to work not on a hospital basis, but probably working and providing services in a tent. And of course, in front of emergency situations like the pandemic of COVID or before that of Ebola, when you know that you have almost no vaccines, you don't have treatment, And you know very well that probably the mortality can go up to 90%. So that's also challenging as a doctor to work on such situations where also you need to face situations of your safety. Now, a very important thing, because emergency situations, there are different size and different magnitude, as you mentioned. So what is an important thing is what we need to access. So what we need to access, first of all, is to see what is the size and severity of the emergency. Not everything is emergency, not everything is an urgency. So in order to measure that part, we need to analyze what are the needs of our people or our patients. Among those, we need to see what are the vulnerable groups out of this situation that are being more exposed. We need to analyze what is the local response capacity, what is the response being done by international agencies and organizations, but always keep in mind that, we are not heroes, and we need to keep always in mind the security of the team intervening in this emergency situation. As a medical doctor, what is important to be prepared from your side, I would remind to you that you need to keep in mind three very important things: time, place, and person. This is when you want to analyze a situation, and you need to do a data compilation of this part. What does it mean, place? You need to see the geographical extension. So before, the colleague was talking about the earthquake in Izmir. So what is the geographical extension of this emergency? Was the city of Izmir, not further than that. Then a very important thing is to see the time, when the emergency started and how it's been evoluted. So for example, in the case of earthquake in Izmir, you had a situation that started and it continued for a few days, and was it. So in a way the process stopped, but what did not stop is the population affected. So I have been monitoring, for example, the emergency situation and the earthquake of Izmir, where in a week time, we could see people being affected, people that had lost their life or people who were wounded and sent to the hospital. So keep in mind always the geographical extension, the starting point of the evolution of the emergency, but also the population affected out of that situation. So just to give you an example of another emergency, that was an outbreak of malaria. So you see here a graph in your screen, but what we need to analyze as a medical doctor, that's why we learn epidemiology, we need to analyze, first of all, as we said, the time. So this is the evolution of an emergency situation during months. We need to understand what is the place. So the place is somewhere in Niger, so the city of Madawa. And of course, we need to see the number of cases. So like this, we can analyze both the time of evolution from January to October, and we never see also the number of cases in order to intervene on this type of situation. Now, when you go as a medical doctor in the field, we always have to analyze what are the population needs. So that means what are our patients' needs. So first, we have in every emergency situation, the population always has a coping mechanism. What is the coping mechanism? So when you are based in Ankara, Istanbul, Athens, or wherever in our places, and an emergency situation is taking place in a location, for example, today you have an outbreak of Ebola in Guinea. So people, they respond themselves and they try to support the situation. So that's their coping mechanism. And then when this coping mechanism is not that in place, you have also local response capacity. So people coming from neighboring cities or neighboring countries to assist on the situation. And when this situation cannot be responded by locally, you have an external response capacity. So you see that people coming from different situations, that means NGOs, international actors, including medical organizations. And then what you need to analyze really is always what is the gap. So when we go to a situation, for example, when I went into Dulce and Bolu in 1999, I saw already that there was a coping mechanism of the local people. I saw already the response being done by the government. So what I was I was part of a group to respond to the gap. So what is not being addressed at that moment from the situation. Always in emergency, you need to consider a very important thing. What is our activity we need to do as medical doctors? So in the acute phase of the emergencies, the most important thing is that we need to work on activities that are related to life-saving activities. So we need to see what intervention we need to do to save as many lives as possible. Other curative activities preparedness for epidemic diseases, and then preventive action, it is the last one. So we need to do a prioritization of action. We cannot do everything as normal. So in an emergency situation, we need to focus, first of all, on life-saving and then implement the rest of activities. Something that goes wrong today, for example, with the emergency situation that we are facing with the COVID, we are focusing on COVID and we are forgetting the rest of the diseases. So we don't have to forget the rest of the diseases, but we need to prioritize our action in this intervention. Now, as a medical doctor, I will share with you what are 10 priorities that you need to keep in mind. So the first priority, it is an initial assessment. So what you need to do first as a medical doctor is that you need to analyze what is the situation. Secondly, when people are grouped on different settings, there is a possibility of a measles outbreak. And because we know that there is a very minimum coverage of measles in different countries, we have measles outbreaks, so we do measles immunization. Then we focus on the provision of water and sanitation in order to ensure that people they have water and also to manage situation of outbreaks. We try to offer food and nutrition. Working on shelter and planning is important because that's something that people need to have a place to stay. We focus on emergency healthcare, so people that have been wounded or people who are traumatized or people they face emergency situation. Then we set up a system of control of communicable diseases and epidemics. And in order to do better the control, we need to intervene and do public health surveillance. So it means that we have to put a system in place in order to monitor the situation, how it's evolving. And in order to do that, we need to do in advance, like you are doing now, and you are preparing yourself, we need to have proper human resources that are being trained for emergencies. Being a medical doctor doesn't mean that you are prepared for an emergency. So that's why you are doing this workshop today, and that's why we need to be trained in advance. And of course, the most important element that we forget during emergencies is coordination. Because in an emergency situation, everybody runs to support, but if it's not coordinated action, it will be even more danger and will be messy in front of the situation. And in every emergency situation, always keep in mind the security of the teams. Security that maybe is related to the event itself, when you are exposed to war, exposed to an earthquake, or exposed to flooding or to a disease. So security is very important for the teams. Now, as a medical doctor, your role as you'll be part of the team, because the teams are combined between legislation, are combined between doctors, nurses, and midwives. Your role as a doctor is to analyze morbidity and mortality. So morbidity is the diseases and mortality is the death of your patients. So what you need to see, first of all, we need to see what are the main killers per location. So it's important to analyze the weekly incident rate and the proportional between morbidity and mortality. So different main killers could be different diseases related to diarrhea, measles, or respiratory tract infections. And also when we have to analyze the epidemic diseases, that it's important thing to analyze the attack rate and crude fatality rate. Maybe this sounds a bit Chinese to you, but I think that's an important thing as a role as a doctor. In order to intervene, also you need to do and to learn very well the epidemiology. Otherwise, you'll be talking in general like my mother and my father, who are not the doctors. So in case of an epidemic disease, you need to analyze, for example, cholera, measles, and meningitis, what is the attack rate and crude fatality rate on this situation. And of course, sometimes you need also to analyze situation on the period of malnutrition, about the prevalence of the severe acute malnutrition or global acute malnutrition. Now, the best situation that you need to do today as medical students, and I would advise to do that, is to have emergency preparedness plan. So what kind of emergencies you may face in the country? Now, you are living in a beautiful country that is Turkey, and I really mean it and I miss it. So I've been a long time since the COVID is not allowing us to travel, but you need to understand, for example, in your country, what are the emergencies that may take place in the country. So one of the biggest emergencies that may take place in Turkey is a national disaster, so it's the earthquake. So it's an important thing to analyze a risk analysis chart about what can happen in my country, so that's an earthquake. So I need to be prepared for this emergency. Secondly, what I need to do in order to be prepared. So the very important thing is to set up an early warning system. So the early warning system means what information I need to collect, what is the source of information, what kind of information, who, when, and how. And of course, it's important to to compare information from different sources. So then you sit back as medical students and doctors to decide and on the basis of the risk factors if an emergency is likely or not. So it is important to analyze those information. Now, we don't need to set up data analysis because this is being done from other people. So based on the crude mortality rate, that is the number of deaths per 10,000 people per day, or if you want to analyze the vulnerable cases, that is under 5 mortality rate, then you need always, based on the numbers that you see and interpret, you need to consider if it is a normal situation, emergency situation, or a major catastrophe. Because sometimes I see people also coming on the media saying, well, this is a major catastrophe. Not everything is a catastrophe. Not everything is an emergency. So as a medical doctor, tomorrow you'll be working in a rural area in Konya, in Batman, or you will go to a mission. And when you have a case of a situation, you need also to work and calm down your population, but you need to calm down your population or your data analysis. So based on this analysis, you will be considering if it's an emergency or it's a major catastrophe. Now, as a medical doctor, also, when you go to analyze a situation on different countries, an emergency, or including your country, you need to see the preparedness and availability of medical facility, services, personnel, and equipment. So we need to analyze how far, for example, our hospitals are prepared for an emergency. So our hospitals have a plan. Our teams are prepared, are trained on how to respond to the emergency. And this is also to see the same time that this emergency may affect also our hospital. That means that we may have fatalities and injured caused by the disaster. So, for example, what will happen, for example, if doctors, nurses, and midwives are being killed because of the emergency? At the same time, it's important to see what is the deterioration of health condition following the disaster. So in case of a disaster, for example, the people may have difficulties accessing health structures, or people are affected by different situations. At the same time, you need to see what is the capacity of the health services following the post-disaster recovery. Because the emergency can start and can end, but we need to see also how we are prepared to respond to the next day. So what does it mean that preparation from our side in advance will minimize the fatalities and will minimize the risk of exposure to different situations? Now, in order to prepare in advance and to respond to the emergencies, what we do in MSF missions is that we are trying to reduce mortality and morbidity linked to the emergencies. How do we do that? So in order to reduce mortality and morbidities, you always look at preparing in advance your indicators and also knowing very well what are the main emergencies that may appear. So very important thing, emergency preparedness plan, very important thing, early warning system, and very important thing to have in plan on papers, but also to do exercise time to time. So that allows you to be alerted, but not also being of a surprise when the situation will appear. Another very important element to keep in mind is that if you want to save more lives or if you want to respond quickly, you need to be prepared in advance. What does it mean? That we have on the stocks ready kits. So we are prepared. For example, we know that in this country, earthquake is the main emergency, or in this country, a war may appear. We have prepared kits in advance in order, when the emergency takes place, to put them on the plane and go and respond. That's why the time of response, it is also effective on the cases of your population. So these stocks of kits needs to be available not only on the headquarters, but also in the field. And also just keep in mind that when you are prepared for an emergency, most of the medicines that we use for emergencies are generic names. And at the same time, this allows also to be used by everybody. Just to give you an example, that following the tsunami 2004 in Indonesia, the government of Indonesia had thrown away 36 tons of medication because those medications were in languages that people could not realize and understand what's about. And during emergency situation, you don't have time to look about what is it and try to find a translation about what medication is about. So in a post-emergency situation, yes, you can do drug donation, but during emergency situation, for example, you are learning in the pharmacology as a medical student that for a headache, the best medicine is paracetamol. But when I was asking the medical students in Turkey, because I had the chance to be in different medical schools, what is the best medication for the headache? They were telling me parol. But parol, I don't understand what it's about. So when I'm in emergency, I don't understand what parol is about. But paracetamol, I understand it. When we are in non-emergency situation like now, I mean, if you tell me parole, I have the time to ask you what parole is about. So I think it's important also the type of kit you are prepared of medications. Also, an important thing is that as a medical doctor, we think that we know everything, but we don't know everything. So in the response, in emergency, be a war situation, be a flooding or be an epidemic, we need to have an integrated approach. So we need to participate all together on assessment and planning. We need to involve from the beginning epidemiological surveillance. Also, we need to involve from the beginning different elements with prioritization of that. All are a priority, but priority has to be set up by the team itself. Something very important thing in emergency situation, it's to see the patient management. So it's important to see how we can support the existing structures. So for example, if the hospital is being destroyed, how we need to set up a hospital or a tent hospital, how we need to ensure that there is a proper material distribution, and also how we can combine the availability of human resources. So we need to combine this general healthcare support with the vertical interventions like care for injured people, waterborne diseases, or specific fields like maybe you need, for example, orthopedic surgery, or I'm sure that Professor Mehmet Shuklu-Sever talked to you about Crash syndrome, so nephrology, but also during emergency situation, we need to take care of mental health, because as medical students, you know that health is a status of physical health, mental health, and well-being. So I think we need also to consider vertical interventions in the case of an emergency. Something that it's very important, and I think I would advise you now that you are medical students to work a lot on the surveillance system, because that allows you to collect data about your patients, that will allow to collect data during your activity of emergency, and you need to use just very simple form. So what is a simple form? Is that one case per diagnosis, and then when you are working as a doctor, you collect this information, and based on this information on a daily basis, you are able to understand the development of the emergency. Because you may respond very well in a war situation or in earthquake situation, but then you may miss the situation, especially if you have an outbreak of diarrhea. So if people, for example, be living in a camp, you may have a diarrhea and then it will be killing people and not the earthquake itself. So I think it's important to combine this as a data analysis. So there are different tools that are available, so you don't need to produce those tools from your side. You have, for example, indicators for earthquakes, you have indicators for measles, diarrhea, you have indicators for refugee situations. So having these tools available, that allows you to be prepared in advance and be ready as a medical doctor to go to the field. Now, in addition to the big emergency situation, there are also certain priorities where emergency on a bigger size can go also emergency on a smaller size, meaning that you need to work as a doctor in an emergency room. What does situation? So you have to work in different situation in a very unstable setting. So in a very sporadic violence, you can produce a lot of mass casualties, especially in a war situation. But also at the same time, you can see that emergency care might be one of the main gaps in the place that you need to be as a doctor working there. So very important thing is to increase investment on emergency rooms. So you need to be prepared and be trained to respond to this emergency situation, working in an emergency room. Now, what does an emergency room look like? It's not, of course, an emergency room that you see in your hospitals, but it can be of a different picture. So that can be different situation in different country you can intervene. So it's important also that you need to be prepared that in different countries, you need to set up different emergency situation in order to respond. But also we need to be prepared for internal guidelines and protocols in order to allow that the teams are being prepared and learn this knowledge. So from one side, we set up these facilities in the field. On another side, we train people on different materials in order to be prepared for the situation. So the training part that we have today in the universities needs to be adapted for different emergency situations. It is not different. At the same time, we need to set up indicators for our interventions. Indicators about people and the use of services, indicators about quality and the surveillance. So I think it's important to take that into consideration to see the success of your intervention. A very important issue is that as you are doing this theoretical training today, it's important also when COVID will not be in place to organize also different trainings in order to be prepared for different emergency situations, because that's something that will allow you to be prepared in advance. And of course, after any interventions like we're doing today, it's very important thing, the reporting and publication of different interventions, because we learn out of these interventions how to respond to the other one. Maybe not necessarily copy pasting different interventions, but I think it's important to learn from those interventions that we do in different places. Also, when you are in the field as a medical doctor, I'm sharing with you two experiences, one from Yemen and one from Afghanistan. Both are a war situation, but you will see here, for example, that in Afghanistan, the cases, so the colors you can see here are the triage colors. So you are learning at the medical school about the triage. So you have two situations of war, one in Yemen, one in Afghanistan, but you can see that the number of deaths, it is the same, 9% of death among the patient. But you can see that, for example, the red cases in Yemen were more than in Afghanistan, and yellow cases, there were more in Afghanistan versus Yemen, and the green cases, there were more in Afghanistan versus Yemen. So the green, the black, it's the death, the green, it's the non-emergency situation, yet emergency one. So when you are as a doctor, you face a lot of challenges working in a humanitarian field. The big challenge is access. So today, for example, as medical doctors, we cannot have access to all the emergency situations. For example, in Syria, the government of Syria does not allow organizations to work on the part controlled by the government. So access to your patients is a problem. Secondly, the asymmetric care, so you face different situations where you need to intervene on different type of conditions. And of course, it's a matter also of the models of interventions. So in different countries, you need to adapt your model of intervention. That's a picture from Haiti, where you need to intervene, for example, on a burn cases of patients. Another challenge you face as a medical doctor is that the continuity of care. So we go, for example, in a country like Yemen, or we go to a country like Afghanistan or Congo, but because of the emergency situation, you start working with the patient, but you are not sure about the continuation of care. So it's important to adapt your intervention, considering that this is your last day that you'll see your patient. Because it's not a situation that you are being sure that the next day you are going to see your patient. So try to give to the patient the maximum you can, considering that it's your last time to see. Also, it's important to prepare yourself that you are going to work on settings that you don't have all the tools and all the mechanism in place. So as a medical doctor, you are preparing yourself to, with a very good knowledge in your universities, but also you need to be adapting yourself when you don't have the tools. So your tool in different emergency situations will be your eyes, it will be your stethoscope, and it will be your hands. So be prepared for different situations to intervene that and to do as much as you can what you have. So your role, if you want to work as an emergency physician, it's a role that can be taking place on different situations. You can be an actor for change because you can save lives of people. We need to match also to think and work. So you need to adapt your knowledge to to the context. So imagine that we had to work in a Syria, for example, and in Iraq we had to work, for example, in an apartment to treat our patients. We did not have a hospital, but also we need to consider during emergency the critical mass. So let me give an example. Working in Palestine, we were receiving during the war of 2014, we were receiving 50 children wounded every day. We had 2 operational theaters, and we had opportunity. We did not have opportunity of the intensive care unit. So in that case, you need to prioritize your patient not based on the emergency and the size, but need to be based on how much you can do. So if you have the patient in front of you that needs probably many hours of medical of interventions, you need to prioritize and take care of patients that they need less interventions. Why? Because you don't have the capacity. So I know that every patient is a priority, but in different situations, some people have to die. And I think it's important that you need to prioritize how you can respond to the critical mass of those needs. So the priority thing is that be prepared as very well in advance as a medical students. Train yourself very well in a situation of non-emergencies. Be a part of different exercise, and that will allow that you are less stressful, less and more prepared, and consider that always in different situations, you need to be part of a team. If you don't work as a team, your result will be failing. So that allows you to be prepared on that. It is not easy at all because you'll be facing fear for yourself. I mean, you'll be facing situation of security for yourself, and because you go in the middle of a war zone, sometimes you'll ask question to yourself, why I'm here? Do I need to be here? I think you are there because you want to save lives of people. But being prepared in advance will allow you to have less stressful situation, better control of situation. But also you need to know that you cannot save everybody. I know that when you are a medical student, you say, I will be a doctor, ben doctorum, and I will save as many lives as I can. No, you cannot. Just be realistic. But be realistic that we have been trying to do our best to save as many lives as we can. Because at the same time, you'll face another challenge. I've been seeing it also in Turkey. For example, you have patients dying, and you have, for example, the relatives come to attack the doctor. Today, we see medical care being under fire. For example, in Afghanistan, we face bombing from United States Army. In Syria, we face bombing of Russian army. In Yemen, we face bombing of Saudi Arabia army. So the hospitals are being under attack. Even though we know the international humanitarian law says that no doctors under attack, no facilities under attack. But this is reality that you may face. So today we face a challenging situation and we have less tools in our hands. For example, I'm closing here saying that today, for example, we're facing the biggest pandemic, that is the pandemic of COVID. And today, for example, a vaccine that is, let's say, a good tool to prevent the disease, it's not available for everybody. It's available only for people who have money. So I think it's important also to ensure that life, it is not the same value for all the countries. For us as a doctor, we don't have to say that our life of patients in Turkey or in Greece or in Europe is different from life of the patients in Africa or in Latin America. Also, we study medicine, and medicine has the same standard everywhere around the world. There's no different medicine in Africa and different medicine in Turkey. So we need to ensure as medical doctors that we fight for the rights of the patients. And we need to ensure also that access to health, it is not a luxury. Access to health, it is a right for a human being. As medical students, we need to consider that we studied medicine because we want to save lives. I know that some of you will be Zengin doctor, I know that part, but the most important thing is that we need to take care that there is a bit of ethical part on that. Don't be unethical. Money is not everything. And of course, I'm happy to see that, that there are people from Turkey also coming part of the different missions. And I'm very happy to see that many people, they go in different emergencies. And I think I'm very happy to be part of this group today. And I'm very proud to have a lot of friends in Turkey. And I'm happy to see when you take a nice picture with your stethoscope and they say, Ben Doctorum, would you? Very nice of that. But keep that in mind that just by saying that I'm a doctor is not enough. You need to show on a daily basis that you are a doctor, and you make a choice to save lives. That's why be well trained, take care, priority people in the middle of your attention, and you do as much as you can to save as many lives with what you have. At least when you go at night and go to sleep, you say, I did what I could and I did the maximum I could. So at least you'll feel at least quiet on your mindset. Of course, we cannot save everybody. And of course, priority is also that you need to take care of yourself, because if you are not healthy or if you are not prepared, then you will not be healthy to assist other people. I would like to thank you, and I will stop here. So if there are questions or clarifications, more happy to do that. Thank you very much. Teşekkür ederim.
Thank you for this great presentation, Mr. Veizis. And at the beginning of the session, I forgot to take your consent if it's okay for you to record this session and share on YouTube. And if you're not okay with that, we can delay the recording.
No, that's a pleasure.
Thank you for that. And arkadaşlar, yoklama bu arada chat'e atıldı. Şimdi sorulara geçebilirim. And we can start with the questions, and I will read them out loud.
Buyurun.
In your presentation, you said that you took part in 1999 earthquake in Turkey. In the handling process of this earthquake, what do you think can be done better?
Yeah, I think what I realized when I intervened during the earthquake, I realized that I needed personally as a medical doctor better training, because I went there, I was in Dush and in Bolu, and I worked as a doctor providing primary healthcare, but I needed a better training in order to understand what is the effect of earthquake on the population, on their mental health, on the rest of the medical needs. So also, I realized that something that we could improve is the preparation in advance. So meaning that you know that an earthquake may take place. So by being prepared in advance, you can have a better mechanism. And I see, for example, that the intervention that I saw in Izmir during the earthquake that took place, the last earthquake in Izmir, was a better preparation. So I think we are learning out of the process. So being better trained and better prepared, having a better mechanism in place, this is something that it's an important part. I had an opportunity also to be part of and to collaborate the last year, 2 years ago, in a training that was organized by Kızılay in Turkey, together with Professor Kurtuluş, that is working at Medeniyet University. So I see that there is more and more training organized in Turkey. So I think an important thing, it is a training part that allows you to be better prepared and feels less stressful.
Thank you, and we can continue with the next question. Do you think, is it appropriate to be a volunteer just after we graduate and take an action against disasters while we have very little experience?
Normally, what I would advise is that the minimum, for example, if you want to work for a medical humanitarian organization, the minimum that is being asked for is 2 years of professional experience. Because, for example, when you finish your university, you'll go for 3 years to do the rural service. That will allow you to test yourself how your knowledge is being used with the community. So I think you can volunteer on different situations, but you need to realize, what can I do? Because, for example, you are a medical doctor, but you are not trained, for example, how to treat Ebola. So the idea is behind is that you need to be part of a team. You need to make yourself available, but I think you need a minimum time for a professional experience. So not everybody can be responding to emergencies, but everybody can be part of a team. So probably if I am, let's say, the coordinator for the emergencies, I can see where you can be part of. Now, the most important thing in different emergency situations is the coordination. Because, for example, if there is no coordination, everybody runs after an emergency, and you can have a messy situation, more panic, and not positive results. So I would advise to you that if you want to respond and to be part of a voluntary in different emergency situation, you take some time for your professional experience, but also take some time to participate in different trainings to be prepared for that.
Thank you so much. And the next question coming from Hanifi Çetin, he would like to read it himself.
Hello, my name is Hanifi. I would like to ask a question about what is your opinion on distribution of the vaccines in the world? Most of the Western European nations about double the count of their population count, while most poor nations haven't started the vaccinate yet.
Yeah, I think COVID-19 it's did not make any distinction. So COVID did not make a discrimination. So everybody got infected with COVID. So COVID is not asking for a passport. So today, the rich countries, this is what they were doing always. They were taking care of their business, and they always put their economy in front of the human being. So already Europe, for example, have been buying the vaccine doses 5 times to vaccinate some people. Canada, 10 times to vaccinate some people. So today, we talk about public health, but public health is in the hands of pharmaceutical companies. So I think, yes, there is a possibility in order to control public health worldwide, but this is not only related to COVID, it's related to the rest of the diseases. So governments need to prioritize public health, and the governments needs to take responsibility for their own patients, for their own people, and not pharmaceutical companies. Pharmaceutical companies are profiting out of the money of the people. Vaccines, medicines belongs to people, and it's responsibility of the states. So I think today, yes, it is a shame on the rich countries, including European Union, United States, Canada, Australia, Japan, on those the rich countries who do not, for example, accept or sign the WTO, that's World Trade Organization waiver, in order to allow that no patents and other barriers are making access to vaccine difficult for people.
Thank you very much for your comment, and thank you for answering my questions.
And this is the last question. Can you tell us a memory of yours that you can never forget?
Well, there are many memories, so I don't know which one I can choose. I have been facing situations where many times I question myself why I'm here. Because, for example, when I had to face, let's say, my life in danger, like it was in Afghanistan, my question was like, why I'm here? Or when I was in Lebanon, I had the same question. That what keeps you there is that you have other people that you make them happy, or you are there as a doctor providing safety for other people. So, but as you asked the question, what is my memory? I will not ever forget situations of children in the refugee camps on the Greek islands, where I see them, for example, not having access to very basic things. And that is a memory that I cannot, for example, forget about, especially when children that we consider that this are our future are exposed to situations that are not into consideration, taken into consideration from our side. So yes, situation with children are the one who it's more touchy for me, because that's, let's say, the part of the population is less protected and has less ability to respond to different situations.
Thank you, and that's all for the questions. And I would like to thank you personally for joining us again. It was a pleasure for us. And can we take a picture together?
They need to open the camera, so you take a picture and share the picture, and I will share this picture around.
Okay, I will send it from email to you.
Teşekkür ederim.
Yağmur, can you take...
Arkadaşlar isteyenler kamerasını açarsa. Sen çek, ben de çekeyim Elif.
Okay.
Just will take a picture and then you can close back a camera. So you have nice cats and nice dogs, but I think it's also nice to see you.
I'm counting down from 3. Okay.
And hope to see you soon in Turkey. So I hope COVID is over and we'll see each other in person. I do miss that part a lot, unbelievable.
We will be very happy to see you. And 3, 2, 1.